All right. And so, Colleen, you were going to share out your report out.
Yes. So what I'll do too is I can send you, I reached out to the leader and I can send you digitally what that looks like. So you'll be able to make that a little easier for yourself. So I'm pretty much going to read it. So basically for Parkland, anyone that comes in to originally they started this program in the emergency department, but then they branched out. So they're now in, basically most of the hospitals. So PCU, ICU, med surge, behavioral health unit, and the emergency department as well. So if they come in and they get screened for food insecurity, they're offered the new resource bags, which has a lot of the like granola bars and canned items and such, but also they really ramped up the the handouts for that, and including it is cheap recipes, the food banks across the county, the information on the mobile food kitchen, Meals on Wheels, and information on healthy eating. So that's exciting. So I don't have numbers yet, but I know this is something fairly new that they branched out to these other departments. So I think we're going to see, and I can report when I get that back. I can report out to this group before the meetings what those numbers are looking like. So, but another great addition to that is that they are offering a frozen meal program for staff. So let's see. So when the kitchen has leftover meals from dinner, they'll freeze them and put them in a freezer that is dedicated specifically for this, and it's accessible in an accessible area for all staff. And it's just anonymous. So if anybody feels the need that they need a frozen meal and no questions asked, they can just go in and grab that. And so far, they have 12 staff members that have used those frozen meals. So that's really exciting that, Parkland is taking care of their staff and their patients. So I will definitely forward that information out to you in bullet type information, so it's easy to read. But yeah, it's really exciting to have these pantry bags, and the committee is really going gung ho as far as enhancing that and pushing that out and seeing what the patients need. So great news on that end. So for me with public health, when I get the information from Jim with the mobile food pantries, I push it out to a lot of my partners, and including Parkland as well. And I know we are having a emergency preparedness event for the community-wide event at the end of September. So we may have a resource table. It's going to include stations specifically for emergency preparedness, but at the end we may have resource table or resource tables that we could include some of this information as well for the food. And if people are looking for volunteers as well, we may have a volunteer tape. So I saw that, Karen. So yes, so I'll reach out to you guys and let you know. We're very early in the planning process. And once we know more, and I would like to have the resource tables because it seems like there's so many great resources. I actually just came back from the volunteer organization for in disaster, the VOAD annual meeting, and food pantry, the food bank was there, and the Southern Baptist. It was just so many great resources there and networking opportunities. So I heard a lot about what's going on across not just New Hampshire, but Maine and Vermont as well. So really exciting stuff there also.
Amazing. Yeah, thank you so much for that. And wow, Colleen, there's a lot going on. That's so exciting. And we only just started to record after Karen had shared. So if you don't mind just summarizing really quick the things that you're looking for from partners and offering, Karen.
Sure. Do you want me to introduce myself
Sure,
again?
yeah.
Oh, okay. So I am one of the program coordinators with the AmeriCorps Senior Companion Program. We provide companionship and transportation to homebound older adults. We are in need always of volunteers. So folks over 55 who would like to visit homebound older adults. And we're always taking referrals. We also provide respite for any unpaid caregiver that needs a break. Our volunteer would visit once a week for 2 to 4 hours, the same day and time. And I'm also looking for events to be a vendor at for recruiting and networking for the fall and winter.
Thank you.
Mm-hmm.
Great. And now for Stacy. Stacy, did you find a system that's going to work that you can speak to the group? I know she had to switch. I don't know if she's going to be able to speak. We have Dakota joining us. In the meantime, I'm just going to have Trisha and Jessica introduce themselves. Trisha, do you want to go ahead?
Yes. Hi, everyone. I'm Trisha. I'm the Child Nutrition Manager at New Hampshire Hunger Solutions, and I put a couple resources in the chat. Just wanted to spread the word about summer EBT. There's a flyer in the chat. Thank you.
Thanks, Trisha. And Jessica?
Hi, everyone. Thanks for having me here today. I'm Jessica Gorin. I am the Food as Medicine consultant for New Hampshire Hunger Solutions, and I also lead community-based participatory research studies with New Hampshire Hunger Solutions and UNH. And so around federal nutrition program participation and access. And I'll talk a little bit more about that as we go through the presentation today.
Thanks, Jessica. And for this part, Dakota, you're just coming on. We are going around their introductions, but they're kind of like robust introductions. So this is an opportunity and we are recording. And this is an opportunity for anyone from the Derry group that might be watching this later as well to share program updates, partner requests from your community partners here, upcoming events, things like that. So I'm going to go Dakota next, and then it looks like Stacy, we can get you on. So Dakota, do you have anything to share?
I'm not sure if Colleen introduced herself. I work with Colleen at the South Central Public Health Network. And I'm hopping on. I do probably have to hop off early. I'm waiting for someone to electrician. So I apologize. But yeah, I'm sure Colleen has shared pretty much everything that we've got going on right now. So
Awesome. Thank you. How about you, Stacy?
Hi, I'm sorry, I was having technical difficulties. Yes, so over here at Derry Head Start, we do have openings, especially in our part-time class. And that class right now, it normally runs 8:30 to 2:30, but due to staffing, I believe it's only going to be open 8:30 to 12:30 like it was last year. And what's good with that is we have free breakfasts. We provide the breakfast, the lunch, so families don't have to worry about packing a lunch for their children. It's for 3, 4, and kiddos that won't be 5 for the new school year in time. They don't have to be potty trained. They don't have to live in Derry. And I'm actually going to be at Pizza Stock on Saturday. So if you have any families, tell them to go, and I can. SNAP is an automatic qualification too. So if they have SNAP, it's an automatic qualification.
Oh, that's good to know. Thank you.
Same with foster children. Same with families in transitional housing. Transitionally. So
Great.
we do have spaces. It's been tough to fill, but ironically, it's been tough everywhere, I guess, to fill for 3 and 4-year-olds.
Interesting. Yeah.
Yeah.
Well, thanks for being here today, Stacy. And
Thank you.
in a moment, we're gonna have Jessica talk about food as medicine. But Jim, do you want to just introduce yourself quickly and then we will be circling back to your piece?
All right. Hey, everybody. Jim Carey from Heaven's Kitchen. Sorry, I am late. We took our food truck over to Gather and fed the team over there lunch today. So just getting back from that, but good to connect with everybody.
Awesome. All right, so Jessica's here to talk to us about food as medicine, and I'm just going to hand it over to you. I think you should be able to share slides if you want to, Jessica.
Sarah. Well, thank you again, everybody, for having me. And just a couple of things based on everybody's request for updates and stuff, or requests during your updates. Karen, I don't know if you've connected with the United Way of Greater Nashua, but they do have an older adult volunteer program. So I know that Sarah sometimes is looking for places to send her volunteers that are older adults. So that might be a good connection if you haven't connected with them already. I see you shaking your head, so maybe you have. Yes. Okay. And Stacy, we are getting ready to do a child and adult care food program study at New Hampshire Hunger Solutions. And so we, if it's okay, would love to reach out to you as we get started with the project. We're looking to bring on child care center leaders that want to advise the study, as well as participate in it or host focus group sessions around how we could improve access to the child and adult care food program for child care centers and early childhood education centers. So I wanted to throw that out there. And Colleen, it was so great to hear about the work that Parkland is doing. I think it's gonna resonate with our presentation today, and also in your role in the public health network. We are starting to have conversations at the state level about how do we coordinate all this closed loop referral work and really getting people connected into the system as they get screened for health related social needs. Where do they go from there? So, but it's great to hear about the food bag program that you're doing. So, okay, I'm going to go ahead and share my screen. So I've been giving this presentation around the state to the different food councils and at different statewide organizations. I lead the Nutrition and Health Equity Work Group, and we are looking at the policy systems and environmental changes that are needed in order to really implement a robust food as medicine project in New Hampshire. We are a subgroup of the New Hampshire Food Access Coalition that Sarah co-facilitates. So all this work started with the state partnerships to improve nutrition equity state action plan. We received some funding in 2022 from the National Association of Chronic Disease Directors and in partnership with New Hampshire's DHHS Chronic Disease Division. And what we were to do was to co-create and implement a state action plan with partners from all around the state. This would be to expand the implementation of social determinants of health screening, which we now call health-related social needs screening, and to ensure equitable access to federal nutrition programs through training of regional food access coalitions and healthcare organizations. And I believe Greater Derry has done a really good job with this and continues to do this as you guys participate in some of the SNAP outreach trainings, learn about the school breakfast challenge, and learn more about WIC, etc. So at the end of year one, we had a state action plan with 80 participating organizations. Combined, we had created 43 organizational nutrition equity action goals. This meant that people did things around language access, so making sure that their information was translated, or working with community health workers to connect patients or community members to their services. We had hired 9 community consultants from around the state who advised the development of our state action plan. We had over 250 participants attend SNAP training around the state to better understand the nuances of the SNAP application and what families and individuals needed in order to be eligible. And we had 13 healthcare organizations start screening for hunger as a part of this project. We were surprised to receive additional funding from the CDC and the National Association of Chronic Disease Directors in 2023 to continue the work and move towards implementation. So we created a subgroup that was dedicated to nutrition equity, and that's that nutrition and health equity work group. We were to sit down as a work group and create action plans for that work group. And we delivered a training series that covered the culturally effective orgs framework. That's what we use to do our first state action plan, but then we advanced that to see where its intersection, where it intersected with community clinical linkages and social connectedness. We provided technical assistance to healthcare organizations who were screening for health-related social needs and talked to them to better understand like what they needed in order to implement screening and care coordination practices. At the end of 2023, we had designed one nutrition and health equity work group, and we had kicked off a summit. We had 170 attendees at our nutrition equity conference. We had 24 leaders work together to co-design a 6-part training series that was geared towards improving nutrition equity. We had 12 members that started up our nutrition and health equity work group. We had 20 evaluations of those year 43 year 1 actions. And this New Hampshire Medicaid managed care organizations created a Medicaid policy to reimburse for health-related social needs work. So there are currently reimbursements in place from Medicaid, commercial insurers, and Medicare to reimburse for health-related social needs screening, care coordination, and nutrition education. So where are we now? What's happened with our state partnerships for improving nutrition equity up to today? So the nutrition and health equity priorities are facilitating conversations around Medicaid waiver opportunities to reimburse for health-related social needs and food as medicine projects. We are investigating what a shared data plan looks like to really track and understand like who's screening positive for hunger, how are they being connected to food resources, and what are the outcomes for those patients and community members when they are receiving this wraparound care and receiving care coordination to get connected to not only food as medicine projects, but also getting connected to housing or transportation or childcare. We are connecting people and referring them to federal nutrition programs, and as well as emergency food through the closed loop referral system Unite Us, which is a part of the New Hampshire Care Connections program. We are training on and continue to provide that technical assistance on the SNAP application process, WIC process, and school meals. We are working to streamline. So we're investigating potential for direct certification from Medicaid to SNAP, WIC, and school meals, and also in other directions. Some of this direct certification, as Stacy was mentioning, already exists within our systems when families are eligible for SNAP, foster care programs, and other transitional housing or TANF. They are directly certified into school meals and the child and adult care food program. They are also automatically referred to WIC, but we're also looking at that direct certification from Medicaid to school meals. And there has been some conversation about Medicaid to SNAP at the national level. And then we are continuing to engage by conducting local and state food and nutrition assessments to identify what other policy systems and environmental changes we need to address nutrition and health equity. And so we have that community-based participatory research project that Sarah and I are working on to work with people that have lived experience to collect data on their experience with SNAP, WIC, and school meals so we can better understand. And we also want to collect like what are their solutions to the barriers to participation. So how would they solve connecting to those programs? So we are in process of the data collection piece. We have 6 community consultants hired from around the state who are advising this project. The other assessment we are looking to do is better understanding the child and adult care food program and how we can improve that process as well. So sometimes people ask us like, well, why is New Hampshire Hunger Solutions talking about food as medicine, right? Food as medicine might make sense. It may not make sense. So when you look at the food as medicine pyramid, you can see that these population level healthy food policies and programs are the base of the pyramid, which lead toward prevention. And when we talk about prevention, we're talking about preventing hunger. We're talking about preventing poverty and improving outcomes for families that have low incomes. We're also talking about prevention of chronic disease. And as we move up the pyramid towards medically tailored meals, medically tailored groceries, and produce prescription programs, we're really talking about like treatment of chronic disease conditions and helping to provide supports for nutrition, food and nutrition access. But as you can see, that second one from the bottom, that is really in that prevention space, is connecting people to SNAP, WIC, and school meal programs. And just to say that there is that thread along the side of nutritional counseling and education. We know that when that is provided to patients along with all of these other services, that they have better health outcomes as well as they have easier access to nutrition. And I'll just pause for a minute. Any questions about the food as medicine pyramid? So when we started to learn that other states were leveraging Medicaid to pay for food as medicine projects and really to support these health-related social needs screening and care coordination projects, we learned that the states were really emphasizing 1115 waivers. There were 7 or 9 states right now that have 1115 waivers that help pay for food as medicine programs. New Hampshire already has an 1115 waiver that supports the infrastructure cost for the Unitas closed loop referral system, as well as point click care, which is a electronic health records tool that helps to tie in, like follow the patient from healthcare system to healthcare system so that their data follows them, so that no matter where they go, their provider can see what services they've received from another healthcare system. So those pieces of infrastructure that are normally in a food as medicine 1115 waiver, New Hampshire already had in a behavioral health waiver. So we're really focused on in lieu of services, which means that instead of receiving a prescription or instead of for medication or instead of going into the emergency room, a patient would receive a food prescription. So they might receive medically tailored meals delivered to their home, produce prescriptions, or medically tailored groceries. And that would help to reduce their reoccurrence of chronic diseases, as well as their readmissions into the healthcare system, so into the emergency room. And we've seen that there was over $100 billion in savings, there was less healthcare utilization over this study's lifetime. We saw this is nationally 120,000 less cases of type 2 diabetes that were either prevented or postponed, and 3.28 million cases were prevented or postponed for cardiovascular disease. So New Hampshire is looking at this in lieu of service waiver to implement that. And also a 1915C waiver helps to deliver those medically tailored meals and produce prescriptions or medically tailored groceries right to a person's home if they are an older adult or somebody with a disability who is choosing to receive their care at home instead of in a long-term care facility. And so we are working with the Bureau of Aging Adults on improving their policy in their 1915C waiver so that patients and families participating in this program can receive more medically tailored foods. So these are ways that we can leverage Medicaid in New Hampshire right now is through the health risk assessment or the health related social needs screening, also through various lifestyle counseling around nutrition education. And these are the current billing codes. These codes are national codes being offered by Medicaid, Medicare, and also commercial insurers right now. And they're also they're being reimbursed by those commercial payers as well. And then this is the care coordination piece. So this is where I feel like really comes into play for all of our food councils. When you connect with CHWs, when you have a client or a patient who's screening positive for food insecurity, transportation, housing, they can work with a social care worker, a community health worker, or another healthcare navigator within the healthcare system that can work to connect them to SNAP, WIC, pantry services, childcare, all of that time of care coordination and utilizing the closed loop referral system can be reimbursed using these current billing codes. So that's where we're at in New Hampshire right now, and that these are available for those services. A lot of times what I'm doing right now is I'm really working with our healthcare systems and our public health systems to start utilizing these codes to see what the reimbursements are and seeing how we can improve them, like what are the barriers to utilizing these codes, or what are the successes to utilizing these codes, and how can we integrate it into the current healthcare system, like electronic healthcare record systems and billing code workflows. These are, this is a one pager I can send out after. These are the services that the Medicaid managed care organizations currently provide to their clients. So if you're working with a client that is in AmeriHealth Caritas member, they have access to a Care Cards reward program. They can receive up to 14 one-way trips to grocery stores, laundromats, their SNAP appointments, etc. I will just say that those are 14 one-way trips. So if it's a round trip, it means that it's only 7 trips. They have a wellness and opportunity center where they have cooking classes and yoga classes. They offer 3 months of Weight Watchers, and they have a 24/7 nurse line. And I won't read through the rest of them, but just to say, like, these are what those examples look like. And then the phone numbers are under each column of each managed care organization. You can reach out to them to connect your client or patient to their services. I do want to mention that some of them are offering, all 3 of them offer home delivered meals or post-discharge meals, which means that after a patient leaves the hospital system, they can receive 14 days of medically tailored meals home delivered to their home. And that is 2 meals a day for up to 2 weeks, paid for by the managed care organization. And we're really working to make sure that patients are getting connected to those services, because that's something that's underutilized. If your community doesn't have a social worker or a healthcare navigator that is helping somebody to get connected to SNAP, WIC, school meals, and other programs in their community, each of these managed care organizations also provides care coordination. So by calling that phone number at the bottom and connecting your client to their managed care organization, they can start to receive those care coordination services to address their health-related social needs. I will also say that all the MCOs are currently on the Unitas platform, and they're waiting for more community-based organizations to sign on to the Unitas platform so that they can send referrals. So as they provide care coordination, they would be sending referrals through the Unitas platform to other community-based organizations that are signed on and receiving referrals in their community. For this group, we won't go deep dive into a shared data plan, but for our healthcare and public health peeps in the room, this is going to be a really great way for us to do community health needs assessments and for us to see the impact of when we implement health-related social needs screening and provide food for those patients that are screening positive for food insecurity. Because if everything is going through the EHRs and there's a data sharing plan at the state level, we'll be collecting that health-related social needs screening data and then the care coordination data for how people were connected to services. And it will help us to see our patient outcomes and where we need to continue to focus on improving access to care for patients. This is an example of what this workflow could look like. So as the patients report on their health-related social needs, a navigator helps them get connected to community resources. Through the closed loop referral system, they're then referred to community-based organizations. They might get referred through their electronic health records to other healthcare providers. And then the piece that I think that this diagram needs is like one more connection, which shows that all of this information goes up to the state, where their public health and Medicaid and chronic disease teams can see the data and see what the impacts are, like implementing these systems. And also, if they have data on patients, they're adding it into the system and sending it back down the line. We've talked a little bit about New Hampshire Care Connections, but these slides are directly from the New Hampshire Care Connections website. Oops, sorry about that. Just switched there. Are you still seeing the New Hampshire Care Connections slide? Okay. Oops, it's still doing it. All right, let's see if I can do it this way. For whatever reason, it's like clicking on the thing here. Okay. So we're looking at whole person care when we look at the New Hampshire Care Connections project. This is really that community clinical linkages piece where we're really making sure that it is easier to connect people to the services they need, protecting people's confidentiality and privacy as they navigate the healthcare system, and ensuring that people aren't falling through the safety net, and that they're receiving their being able to achieve their best health outcomes. We know that New Hampshire Care Connection protects that personal privacy data. These are New Hampshire Care Connection slides from the Unitas team, but these are some more data that people get connected to resources faster when they're using the closed loop referral system. There was a 79% reduction in postpartum readmissions by connecting patients to what they needed. This was out of Florida. We saw a 16% decrease in emergency room visits through a study that was done with the Unitas team. So, and 2 times increase of people likelihood to follow up with their PCP. This was as of May. We saw that through the New Hampshire Unitas New Hampshire Care Connections project that we have 95 active providers on the system, and 66 referrals had been sent through the system. So Greater Derry gets celebrated all the time. You guys were the first ones to have a closed loop. And now we have seen that there are 66 closed loops that have been achieved through the system, and that number continually goes up, and over 4,000 clients have been served. Right now, the Unitas program is going around the state. They're focused on the Upper Valley right now, and they are piloting these conversations and closed loop referrals. And they are moving to the state. They're going to Concord next, and I believe they're coming to Southern New Hampshire to be announced shortly. So from 2024 to 2025, we have over 60 members now in our nutrition and health equity work group. We had the first closed loop referral in Derry. Coalitions are continuing to train on food as medicine, federal nutrition programs. And we have now 2 grants that fund our food as medicine work at New Hampshire Hunger Solutions. These are the things we're hearing. We've talked about this, that community organizations have limited capacity to participate, and that they might already be using another system. There's not enough CBOs on Unitas. Communities want more trust built with the Unitas team. We need more voices of lived experience, and healthcare organizations are unsure of who to refer patients to. So the things that we can do is continue to connect with our local CHWs, navigators, and MCO services. And we talked about that in the other slides. We continue to connect organizations to the New Hampshire Care Connections team to receive referrals through the closed loop referral system. We can continue to host listening sessions so we can learn more about what your needs are about participating in the closed loop referral system and connecting clients to federal nutrition programs. the client experience study, we will hopefully be able to expand to more areas of the state so we can better understand the client experience with federal nutrition programs. And we are continuing to really hone in those policies with our managed care organizations and commercial payers to reimburse for food as medicine projects. This is a little bit more information that Sarah will send out about the lived experience project. And I will stop here if there is any questions or discussion.
Thank you, Jessica. Questions for Jessica at the moment? As it evolves? Yeah, go ahead.
I'm curious. It's Jim Carey from Heaven's Kitchen. Is there an ability to for folks who receive vouchers to get meals from our stops as well? I mean, is that a need at all? Do you know?
I think that's where we're going with the design of the policy is that our community-based organizations that provide food to community members would be able to be reimbursed for that food if it's medically tailored. So we're really trying to identify partnerships that we can pilot so that we can see what that looks like as far as referrals to the program so that patients can utilize services like yours, Jim, and also reimbursement for the food that's provided by the healthcare system through Medicaid, Medicare, and commercial insurers.
Cool. Well, as you continue with that process, certainly if you're looking for pilot partners, we'd love to chat.
All right, awesome. Thank you, Jim.
Mm-hmm.
Jessica, I was just curious if you have you tapped into the New Hampshire HCA hospitals, like including Parkland and now CMC, and I'm not sure how involved they've been with this or.
Yeah, I haven't tapped in with Parkland, so I was glad to see you here today, Colleen, because I'm hoping to connect with you afterwards. And with you and Jim working in this through this group together, maybe there's a pilot that we can do with Parkland and Heaven's Kitchen here. No, I'd like to talk more. I've been working with Foundations for Healthy Communities, and I've been connecting with the healthcare organizations through the population health work group there.
Oh, okay, great. Because with HCA, so HCA owns Parkland, CMC, Frisbee, and Portsmouth Regional too. So I figure if you have an in with HCA, the New Hampshire market, that might allow you to branch a little bit out to those hospitals.
Yeah, absolutely. If you have a connection, I would love to be connected, Colleen.
Okay, yeah, we can definitely talk offline.
All right, great. Thank you.
Okay, thanks.
I was also thinking of any of like the acute rehabs around here. I think a lot of the times, like Northeast Rehab, I think would be a great place to also go. They tend to send people home, with case management and, they're leaving with whether it's, like major heart issues or a fall. So they have, limited walking, so they're not really making their own food. A lot of elderly. So I'm thinking that that'd be a good place to also go.
Yeah, that's a great connection and really ties into how we want to create the system so that patients for instance, in that situation are really being connected not only to medically tailored meals they can receive through Medicaid and Medicare, but also like the choices for independence waiver so that they have access to all the services that are being provided through their home health care.
Yeah, I mean, and there's, as far as I know, there's one in Elliott, Nashua, Salem, and Portsmouth. So decent coverage around the
Mhm.
lower half of the state, but
I feel like everyone on the call could have an additional sort of follow-up, and maybe that's even something we'd be happy to facilitate that. In the interest of time, I do want to give Jim a chance to talk about the idea that's been brewing about a community-wide food drive. And yeah, other than that, we'll try and stay on time, but I would be delighted to help organize a deeper conversation about pilots for all of you. So, Jim, are you ready to talk about your event?
I am. Could you do me a favor and do you have access to that playbook?
I do. I'm
Um,
just right
if
now,
you
I'm
could,
dropping it in the chat, and now let me navigate to it and I can share my screen.
oh, that'd be great. Thanks for
Yep.
that. I definitely would not be able to get that done on my phone.
Yeah. So is everyone seeing Greater Derry Coalition Community Food Drive Playbook? Awesome. Go ahead, Jim.
Okay, so we had talked about the possibility of doing something on a community-wide basis, really pulling in a lot of the community partners in the Greater Derry area, and doing a community-wide food drive at some point this fall. So I agreed to do a little bit of legwork in advance, and that's what this playbook is. I'll also share that I did have a conversation with Tim Powers, and he is definitely open to us utilizing a space at Pinkerton for this event. We also talked about a way to enhance this event could be to maybe do it before a home football game. And he was pretty excited about getting some student groups involved with helping to facilitate. But as you can imagine, if we can pick, I think they always have pretty good attendance here, but if you can pick a good rivalry or something, there's likely to be a pretty big crowd, and we could get the word out for those folks to really participate in this process as well. So I know time's getting short, so I'll kind of walk through um, the key points of this. And there's certainly, it's just an outline. It's just thoughts and ideas. So it's wide open for further development, discussion, changes, or any of that. But really, our vision was to have one community, one mission, feeding our neighbors. Really kind of pulling together as a group of community partners who would all share, obviously, in the bounty of this community food drive. Goals would be to collect food, increase awareness about hunger, recruit volunteers, strengthen collaborations. Just another way for us all to continue to work, to partner together and to bring the strengths of all of our organizations to play in creating something, a lot more meaningful. We're all probably going to be involved at some level over the next 6 months between now and Christmas time in kind of local food drives and things like that. This is sort of looking to take that on a grander scale going into that holiday season. Um, and obviously look to distribute donations equitably and fairly after that. Um, there's some information here about planning timelines. We definitely want to form a few subcommittees to really tackle some of the key pieces, and that might be, like sponsorships, marketing, communication, volunteer coordination, operations and logistics, like what's this going to look like and where's the food going to be put and all of those things. And finally collecting food and then redistributing of food. um, Finance, what do we need for funding to make something like this happen? And then clearly confirming participation by a list of community partners within the greater Derry community. Um, just a quick rundown of suggested event features. Obviously would want to do it as some sort of a drive-through format, and I think there's plenty of room at Pinkerton to be able to arrange that where it won't interfere with other traffic that's going on, i.e., if there's a football game, they've got a traffic pattern that they already have and expect for that. So we could work with Tim and his team to sort of figure out how can we make this as convenient as possible for folks that are going to follow that traffic pattern to get to our event on their way to the football game. Partner information tents might be another great way, to highlight all the local partners in the community, especially going into the winter months, and have people have our community partners have tents at or around where the football game is being played so that folks can kind of stop by, visit, pick up pamphlets, talk about, what programs are coming in the fall, winter to help those in need. Live music, certainly we might be able to pull, the Douglas Flood Foundation. I'm sure they'd be wicked excited about getting their kids involved in something like this. But having something like that, food trucks, certainly we would be interested, and I'm sure there are others who would as well. Um, it's just a kind of really looking to expand it beyond just a simple food drive, but make it informative to where people really have an opportunity to see what's going on in our community around food insecurity and how we're responding to it. Um, I think that's, and then there's some stuff later on. We're pretty early in the process, so there's no need to go through, the day of and the week of time frames. But that's sort of, I wanted to put that together to sort of give some sort of substance to what we had talked about at our last meeting in terms of just holding a community-wide food drive, what that might look like. Um, so I think that's probably the gist of it. I think it sounds like there's a strong, I haven't gotten the final okay, but I would say we're 90% certain that we could hold this at Pinkerton Academy, probably 80% certain that we could hold it around a big event such as a football game or something like that that would kind of have a ready-made crowd for us. But beyond that, it's just an idea and some thoughts on paper waiting for folks to jump in and fill in the rest of the mosaic, I guess.
We have a question from Colleen or a comment.
Yes, thank you. Thanks, Jim. I'm really excited
Colleen.
about this. So yes, absolutely. The Pinkerton Londonderry game is huge in the area, but also for your awareness, Derry Start, my MRC team, could help with logistics, and the Derry Start team could probably help with traffic. So please put me on your committee because I think this is absolutely great, and this would be a huge, huge positive thing for the community. Thanks for bringing this forward.
Oh, absolutely. Thanks for the offer. We'll definitely, you're on a committee already, so.
And Dakota raised her hand. Are you volunteering too, Dakota?
I mean, always when it has.
She's already signed up.
Yeah.
She doesn't know it yet.
Yes, exactly. But I have the one question, Jim, is like after we collect, how do we plan on distributing it to different organizations? Like, is that our plan? How do we?
Yes.
Okay.
Yep. So, and just as an example, certainly, Upper Room has a
Yep.
food pantry. Marion Garish has, the blessing box. So we'd kind of pull all those folks together. First of all, confirm who's going to participate, who's going to be part of it. And then would likely have a team of folks that would work to kind of figure that piece out about distribution. I will say we'll talk more about it in the coming weeks, but we've got a really nice expanded partnership started with the New Hampshire Food Bank that will kick off a week from tomorrow with our first combined mobile food pantry in the greater Derry community. We're expanding that to Salem. But I think how that could be helpful in this circumstance is that I'm sure we'd have access to, with the amount of time we have to plan, some refrigerated trucks and just regular trucks to help collect and distribute this food. I think that would probably be a given.
So for a time check, we're just a minute past 3, but any last question or two on this topic?
Nope. I'm in.
It's
Yes, you
awesome.
are.
I'm so excited for all of you for this event. I'm going to stop recording now.